the way government is trying to curtail Japa, I just pray they won't push Nigerians to start using the legitimate roads to Japa, because when you are pushed to the wall,
Yeah. Instead
they talk about you fight back, but many times these days we've learned that fighting back
doesn't do anything.
Why not just break the wall?
Are you tired of constantly hearing about the many problems that plague the Nigerian healthcare sector? Because I am. And if you are too, then this is the right podcast for you. Hello and welcome to Diagnosis, where we discuss about the Nigerian healthcare sector with a twist. We try to profess solutions, hoping that someday somebody somewhere finally listens to the lone voice crying in the wilderness, shouting and saying, these are the ideas to implement. These are the ideas to implement. These are some of the solutions that we can put in place to ensure that the Nigerian healthcare sector becomes better, way better than it is today, better than it was in yesteryears, what we now refer to as the good old days. I am your host, Catherine, and it is a pleasure to have you all here with me today. I hope you have fun listening to this episode. I hope you learn a lot from this, and I hope to hear from you in the comment section. Leave your feedback, leave your comments, tell me more, increase my knowledge, correct me if I'm wrong, and let us know how we can all come together as a people to fix the Nigerian healthcare system, because a good healthcare system in this country is a win for you and a win for me. Today we have with us in the studio our fan favorite, Dr. Olofin. Yay! Let's all give it up for Dr. Olofin. Hi, Dr. Olofin.
I'm the number one fan for myself. After me.
After you, I think we have like a fan club for you. Well, I'm going to make shirts soon. Dr. Olofin's number one.
I'll appreciate it.
Okay, you will, Ba.
Yes.
No problem. All right. So today we are going to be discussing about the leave of absence, the proclamation that was made on the 10th of March when the Minister of State for Health, Dr. Tunji Alausa, was in Abeokuta. And he said it was a presidential decree that had been sent to the CMDs of all the hospitals that every medical personnel, if they want to Japa, if they want to leave the country, they must, tender their letter of resignation. And then there is an uproar. For me, I think when I read the article, I was in line with what he said, because if you're going to leave the country, I don't think you should take a leave of absence. I think you should actually, put in your 2 weeks, your resignation, and let them know that you are going. Because the entire point of Japa is because you are relocating, you are leaving to go and do something else. So why take a leave of absence and still be collecting federal government salary, and then you're in another country enjoying that benefit? You want to eat your cake and have it. It makes no sense. So why is there that pushback from doctors and other healthcare professionals? I don't understand it. And I feel like that's, something we should discuss about, because if we are all interested in a new and improved health sector in the country, I think we should also be interested in one that is accountable, in one that is transparent, in one that is honest.
It's actually an interesting topic. And the minister is saying something very good. Yeah, it's a good point. And also, whatever you say that won't favor some people, those people who are at the short end of the stick would always have something to say about it. Yes, on both sides, we can have one or two things to say. Then on the minister's side, leave of absence in court, it's one of the benefits as per welfare to civil servants in general, right? There's no special leave of absence for Japa at all. There's nothing like leave of absence to help you to leave Nigeria as per Japa in court. As it is, every leverage offered to any Nigerian anywhere, they try to optimize it, like use it, overuse it, like giving
exactly
allow and the person
take
takes that allowance.
Yes.
That's just the way it is. The same way a doctor would Japa under the auspice of leave of absence. When you are traveling to all these countries, it's like taking a dive into the unknown. So you want to secure what you have.
All right.
Like I said, when you give allow, people take allowance. All right?
Nigeria.
Yes. So the same way it applies to a doctor. The same way everybody enjoy this thing. Yeah. You need everybody, any civil servant. But the thing is that criteria for leave of absence.
You mentioned criteria.
Yes.
Yeah, I don't know. Could you tell us some of the criteria so we are better educated? Because I don't even know. Thank God I don't work with the federal government, but still.
Okay. Luckily, I have a soft copy of the federal government public
On
service
hand.
rule. Yeah. Reading from chapter 10, we talks about the leave of absence.
Yeah.
Actually, chapter 10 talks about different kinds of leave. But here, Article 100 and 100.231 as
Sorry,
it's
just
numbered.
before you go on, right?
Yeah.
Do you have this just on hand in case they are like, leave of absence? I'm bringing it out.
No, you usually I go through these rules because it's been helpful to me. One time or the other, have an issue with somebody, I quote it. Like, please read this part.
I'm screaming. Okay.
Remember
quote it for us.
It's very good if you at least have an idea what is written there. So, for leave of absence, like I said, is in chapter 10, Article 100.231. All right. So, leave of absence is absence of an officer from duty authorized on grounds of public service. All such leave shall be approved by the head of civil service of the Federation on the recommendation of the permanent secretary or head of ministerial office. All right. So next article, that's 100.232 says, this talks about the various types of leave of absence. All right. So A says, leave of absence to join spouse on course of instruction of not less than 9 months.
So your spouse is like going for his or her master's degree and you can actually take a leave of absence to go join your spouse. Will you be paid?
Many times is without pay, but not just, it depends on what you are offered. You can ask for leave of absence, we pay depending on what you are going to do.
Oh.
Yeah, it still has to be debated and see even if you be permitted to go.
To be
okay. So now we have special leave of absence to join spouse on ground of public policy. For instance, you work with FCTA and your wife is an ambassador and she's been transferred to, let's say, China. Yeah, you can take leave of absence to join your wife throughout a tenure in China.
Interesting.
Yes, something like that. Then
I need be someone who's going to be transferred.
So C says leave of absence on grounds of public policy for technical aid program. For instance, Nigeria is sending aid to Ghana, for instance, and you've been selected. Yes. And you are going to be in Ghana for, say, 10 years. You take leave of absence here to join, to go for such program. Okay. The next talks about leave of absence of spouse of presidents, vice presidents, governors, deputy governors on ground of policy, public policy. For instance, if our president's wife, say she's a staff of Lagos State government, now that her husband is the president, she needs to take up the office of the first lady and all sorts. So she gets a leave of absence from Lagos.
But that job, so I get what you're saying, right? So if you're taking this leave of absence and let's say you're going to join your spouse somewhere or you're going for the aid thing like you talked about for as long as 10 years and the rest, there's a vacuum created, but nobody's feeling that vacuum because it is on paper that you are there. So in fact, that's what that is now saying. If we're going to bring it down home,
before we take it home, I think I should conclude with this.
Okay.
So leave of absence of spouse of president, like I said, I know that. Article 100.233 says an officer who is also a public servant. An officer who is also a public servant shall be permitted to join his or her spouse proceeding abroad on a course of instruction. The officer is eligible for free passage at government expense, where the course is instruction is not less than 9 months.
So if I'm understanding you correctly, let's say I'm married,
Okay.
and my spouse is going to do, let's say, PhD, right? Or a
Understand.
master's.
This one says, sorry, let me go through again. Permitted to join your spouse abroad on a course of instruction. Your spouse is being sent.
Okay, so it's the federal government that's sending my spouse.
Yes.
So okay, now
That's for that. That's for that. Then on grounds of public policy, the spouse of a serving officer may be granted without pay for a period not exceeding 5 years to enable him or her join his or her spouse on posting abroad on the following conditions. There are other conditions there.
Yeah.
So what am I trying to pick out of this is that when we talk about leave of absence, it's for civil servants.
It's not restricted to just the doctors.
It's not the doctors. Then when we talk about JAPA as well, everybody is flying out. Okay? So if we want to make some form of restriction for doctors, I don't think it should be on a cover statement of doctors that once with JAPA will not benefit from leave of absence. Actually, if you have the plan, if you are traveling out of Nigeria on the level of JAPA, it's just moral and humane and honorable to resign. Because you know you're not coming back.
Exactly.
Why block that?
Because they don't create that vacuum.
So many hospitals now have a lot of people on their payroll
who are not working.
Yes. And if we say send your nominal role, we have, let's say we have 10 staff in your department, for which 6 of them have JAPA, but their names are still there. But the thing is this, when it's time to, there's this thing we do yearly, what they call it, this form will fill yearly that really tells if you are still in service. Wherever you are in the world, you need to fill it to tell that you're still working and you are doing this, you are doing that, you are doing that. And if you have gone for something, it's something you need to send to the organization or to whoever is responsible for letting you go, know your progress, what you are doing. For instance, you say you have gone for a course, we need to know what you are doing, where are you in that course. Okay.
How far you've gone, if you're almost done.
For masters for 2 years.
Yeah.
After a year, there should be progress report. Where are you? If you are sending nothing, you just go blank for 2 years and nobody is looking for you. If there are people checking on these people who claim they are going for something, what are they doing? How far have they gone? Then you can even tell if they are actually
doing what they say they are doing. Yeah.
So, and if you are asking and no response, definitely their name should be struck out. There should be rules to modify this and not just use cutting of the head to treat headache. And this shouldn't just pick on the health sector. Let me not go down to doctors, because people are living in drones.
Yeah, that's true. But I mean, so why are doctors angry? Because we've seen this happen time and time again, where there are vacuums in the hospital. You're saying a UCH, for example, has only 2 residents in the entire department of pediatrics, and so they are now forcing house officers to now do the work of a junior reg. And but on their nominal role, like you mentioned, right, when they send that for maybe audit or something, you're seeing 16 or 20 residents employed and currently working, which means even the CMDs too are not doing that. Nobody's being held accountable for that problem. The CMDs are not doing the required checks and balances. It's even very selfish on the part of the residents. So yes, I get you. Do not cut the head if there's a headache and all of that, which used to be like a remedy before. They'll put your head in a pot and then bang it. Just take it from the source. But yeah, I digress, right? But yeah, I don't get the anger of healthcare workers, telling the doctors that they are entitled to leave of absence when they have abused it time and time again.
Yeah. Saying doctors have abused leave of absence.
We've seen them abuse it. Let's be honest.
Say doctors have not abused leave of absence.
Okay, thank God you're
But
agreeing with me.
the doctor you are talking about was employed as a civil servant. So I'd rather prefer you say civil servants have abused leave of absence. So if a civil servant who is an engineer works possibly in quantity surveying department enjoys leave of absence without checks, so why single me out if I want to enjoy what is enjoying? What are the checks and balances? Why I will be angry as a doctor is because you have decided to say I'm the only one benefiting from it. Yes, I'm not saying it's the right thing. I'm not saying running out of Nigeria for green up under the auspice of leave of absence is right.
Yeah.
No, I'm not condoning that. I'm not a party to that. But the thing is, now nailing the doctors on this, I think you are just singling us out.
Instead of actually instead of actually looking at the root cause.
Sorry, quickly. Another is, hardly is there any doctor who has left their duty post for greener pasture that somebody is not aware.
Well, someone is aware, but they are going under the guise of leave of absence. Some of them.
I mean, even their bosses, all the way up the ladder. It's not like they are not completely aware. They know that this guy is not coming back. And another thing is, I just think is whoever is leaving the country, whoever is a civil servant that wants to jump back under the leave of absence thing is wrong, and they should pursue that. Not say doctors will not benefit from leave of absence.
So, I mean, you've said everything, right? But, I mean, we look at the Nigerian healthcare sector, we look at the Nigerian governments, the politicians, the leaders who are supposed to be in these places to make the right policies. And instead of addressing the root cause of the issue of the japa, instead of going and finding out, well, they know why people are living in droves, right? Instead of actually doing the right things to make sure that these issues are now, no longer issues, they are now solved, and the rest, they are just trying to put a band-aid on a gaping wound, and that does not make sense. But I mean, if we're even going to discuss per the criteria that you listed out, that you read out from the article, it was not I read out from the article, if you're going to look at it, so this will backfire on them.
Because from what I read out, no part of the civil service rule that says a doctor.
Exactly.
And no part has given a criteria for leave of absence
for japa.
That japa appeared in that.
So they are implicating themselves.
So if you cancel leave of absence, that means for all these criteria I've read out, then it's cancelled. Then it should be across board. Whether you're a doctor or not, no leave of absence. Let's all stay here.
And nobody wants to stay in Nigeria. And it makes no sense.
No, what is good?
Well, it does. It's good for the gander.
Please don't cheat the gander. Can't go and join her.
That's exactly.
Which is clearly stated here in the civil service rule that the teacher, the policeman,
the minister of state,
they can all join their wife, provided she's going to be out for 9 months.
Yeah.
So, for instance, my wife now benefits from being an ambassador of Nigeria to China.
When she does, I know you.
So I can't go because I'm a doctor. Did I offend?
So, what are the possible solutions to this now? What if someone were to ask you, okay, we've discussed the problems, right? What can we say is better? What can we say should have been said or should have been decreed? Because the way Dr. Tunji said it was this kind of, it's been paper stamped. They've put the Gavin down, on the table, and everything is done. So what can you say? What can you give as possible solutions? Because if you were to ask me, I would say, first of all, checks and balances, accountability, transparency. We need to look at those systems, and these are the problems in our country because we lack transparency. We are not accountable people, and the necessary checks and balances are not being implemented. So what can you say? If someone were to ask you, what possible solutions will you give instead of clamping down.
It's just the way Nigerian mechanic does some things.
Did you call them Nigerian mechanics?
Yes, I actually did, and I can say that again and again. You have a little fault in your car, and the only thing they'll just say, "Okay, we'll change it. We need to change this thing."
Well, it's very on brand for the Nigerian mechanic.
That's what has just happened. From what I read out, there are criteria. Scrutinize this criteria. Does this officer qualify for this leave of absence? If he does, either you are giving him,
or you are not.
Or you just say, okay, no leave of absence for every civil servant. It's as simple as that. And like I said, there are still doctors on the street that are not employed by the government and are seeking to have government employment. If you fill up all these positions, there will still be opportunity to give one or two. We didn't say everybody who applies will always get. No. For instance, if I want to go on leave in, let's say, June this year, and everybody at my cadre for June will be absent, and it's seemingly as if I'm going to be the only one that will cover that position for June, most likely my name will not be approved. They will ask me to pick another month. That's why at the beginning of the year, there's a leave roster. Everybody pick when they want to go, and so that you don't empty the hospital the same time. The same thing with leave of absence. If it's tight, then we have to. It's not automatic. It's not like when you apply, you get it. It's still scrutiny. If you remember when I read, the permanent secretary will look at it, approve, and forward to the head of service. So they need to see and know that you really
deserve leave of absence.
And if it's going to be deferred a bit, or whatever, they go through, they sit on it and discuss it and know when it's right for you to leave. That I understand. But saying it's struck off because you're a doctor, that one is too hard.
But again, what's his enemy? What's the governing body doing about this? Is this just going to be another rant, another NMCN?
No. Obviously, NMA is not taking it lightly. And I know they are speaking, and I know definitely
in Nigeria with our mechanics.
This one is a bit different from the mechanic story. I still believe in NMA pushing this to a favorable conclusion on the side of the doctor. And
with this crazy frenzy that they are on to curtail JACPA by doing implementing the wrong solutions. And I call them the wrong solutions because for me, I feel like they are just trying to, they're not addressing the root cause of the problem, right? So if the government, if they decide, no, we don't care, we're not listening to enemy, we're not doing anything, what would the doctors do about it?
We doctors do about it. All of us together.
I don't understand. Is that that's what it means.
I don't know where you are driving to. Like, not to hear things like we are going to go on strike.
I want to know what.
No, that's.
I'm not. It's very on brand for you guys to go on strike every 2 seconds. Strike action. But I just want to know what you guys would do about it.
There are some policy changes that requires real discussion.
Oh, so the ones you guys have been going on strike for, there were no real discussions.
Some that we don't really have to talk too much before. When you remove my money, you may not have to sit too much to deliberate.
So it's only when your money is involved.
No, money is like lifeline. No.
But this one, you can really just resign and just jackpot.
But the thing is, the way government is trying to curtail jackpot, I just pray they won't push Nigerians to start using the legitimate roads to jackpot, because when you are pushed to the wall,
instead
they talk about you fight back, but many times these days we've learned that fighting back
doesn't do anything.
Why not just break the wall
and continue?
People have trekked to Spain, gone on canoes to Spain. They've trekked in the deserts of Morocco. So people will just start inventing all that. When you learn to shoot without aiming, boys will learn to fly without pitching. So
Interesting. This is really... People have trekked to Spain.
You've never heard of that?
Never heard. I thought they used to like go through Mali, but not trek Libya.
Trek, people die in the desert.
No, I know they die in the desert, but I didn't know they were trekking. I thought maybe they'd like use cars, like rickety cars or something.
Okay. May you not experience it.
No, where will I trek, sir? I'm not trying to trek to Spain. I'm not trekking.
I've met somebody one-on-one
who trekked to Spain.
Yes.
Why did the person come back?
He didn't come back.
He has...
Right now, he's a nurse in London.
And he trekked? How did he do it?
They trek some part, they go on rickety cars in some parts, then on
What's the route?
they take some canoe on the sea.
But that's really scary.
Then it's
No,
a
I
scary
know that people...
story.
I thought they would like hide inside the ship.
If you eventually escape the Spanish bullets, those coast guards are not smiling. So.
Dr. Olofin, you seem to know an awful lot about this trekking. Have you maybe perchance tried it?
No, I didn't plan to trek, but I want to drive to Europe one day.
You want to drive?
Drive, yeah.
With which car?
No, there are a few
Hinoson.
cars that I could do that.
You want to use Innoson or Nord? I think Nord would be good.
I know the cars are really made, like Land Cruiser, I've done it, Range Rover too.
I think we should try a Nigerian
Lexus,
brand
Jeep.
to Nord. Nord is in the league of them Land Cruisers. It's a very rugged car.
Right now, I'm speaking about tested and trusted. So I
You
don't.
should be the first to test it now.
I don't mind. I have it in my pocket.
We'll reach out to the CEO of Nord and then tell him. I know him more. We'll reach out to him and tell him
on my
that,
bucket list. So.
come and give us your car. Let Dr. Olofin test it.
Yeah,
to
Europe
Spain.
by road.
To Europe, by road.
Yeah.
Oh my God, I will reach out to him tonight. All right, thank you guys. Thank you so much, Dr. Olofin, for coming in today. I mean, we've learned a lot, right? I feel like the Nigerian government, instead of really addressing the root cause of issues, and I will be using root cause a lot because I just finished taking a project management course, and so they taught us root cause, objective tree, and the rest subjects just went in my head. So I feel like you will hear the last of this. I wrote an exam and I aced it. So yes,
In the blood. It's in the blood.
Anyway, I just hope that I just hope that the Nigerian government can understand that the solutions that they are trying to implement to curtail this jackpot thing are not the right ones. And it makes zero sense for them to continue to, not look at the main issue on ground. Listen to people that have come time and time again to let you know that SARS, MARS, no, it is not by increasing NMCN verification fee. It is not by saying they must get letters from CEO. It is not by saying they won't take leave of absence. Do the things, do the needful. 1, employ more doctors. 2, remunerate them adequately. 3, their hazard allowance, their welfare. There are a lot of problems. Infrastructure, do the right things, right? And maybe you can be able to, bring even those that have left the country back into the country, and then we can start to fix the Nigerian healthcare system.
We really don't want to go. Make the country.
Honestly, make the country conducive. Security-wise too.
In fact, to some extent, the weather is really harsh now, very hot.
Exactly.
To some extent, anyway, I think we might not be much on this table. I enjoyed this heat than that crazy cold.
No, Dr. Olofin's been crazy. The heat has been horrible.
The crazy cold is crazy. I don't like it.
Wear winter jackets. Wear jackets, please.
I don't like it.
All right. Thank you, guys. Dr. Olofin. We'll be seeing you next week. Hopefully, we have lots more interesting topics to discuss, and we would love to get your way in on those topics. I remain your host, Catherine. This is Diagnosis. Don't forget to subscribe to our YouTube. Don't forget to like our Instagram, listen, comment, Spotify. I really love your feedback on all of those channels, and they help us to grow as, a network, and they also help me to grow as a person, right? And I hope you guys enjoyed the show as much as I enjoyed bringing it to you. Thank you for listening. Bye.